Assalamu alaikum. I'm Dr. Asfandiar Khanzada, and today we will be discussing a little bit of some respiratory conditions which are prevailing in this environment or this season. As you know that summer is in some areas, some parts of the world, the summer is in full bloom, and in some part it's coming. And most of the people are suffering from a kind of a viral flu or 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 allergic rhinitis type of symptoms. But it's very important that you should be knowing that during the change of the season there are a lot of pollination ongoing in the plants, and a lot of germination is going on in the plants. So as the summer is approaching and afterwards the monsoon will be approaching, so it's a natural life cycle of the plants to carry on this thing, that after the flowers they go into the pollination phase, and then after the pollination they start getting growth somewhere when they are germinated. So another thing is, some people are allergic to these pollens. What are the main things which we have to follow in order to avoid this allergic rhinitis and viral kind of flu? So the first thing is, you are supposed to wear mask. Mask is very much important, and it not only it will protect you from a lot of miseries because of this weather, changing weathers and dust pollution, but also it will prevent you from getting into this pollen inside your body, and which will produce the allergic symptoms. Before going into the more details of how the pollen energy happens, and what are the pathophysiological changes that happens in our body, and what you are supposed to do to prevent this condition, first you are supposed to know that how pollen allergy works. What is pollen allergy? So pollen allergy, actually the inflammation would start from the nose. This pollen particle gets inside your nose, and this nose mucosa, which is this nasal mucosa, is more sensitive to this, catching this. As a first defense, it catches this pollen. So now the bodies, you are allergic to this pollen. Anybody who is allergic to this pollen will get an immune response, which will cause the inflammation, and this inflammation then goes from nose towards the throat, and from throat towards that of the chest, producing a cascade of symptoms from neck, nasal blockage, pharyngitis, and then the respiratory, upper and lower respiratory diseases. So this is the thing which you are supposed, in simple words, you are supposed to know that what the pollen energy is actually thing. Now, talking about the statistics of this disease, so if we talk about the statistics of the United Kingdom, so every fifth person is suffering from the pollen allergy, and the signs and symptoms of this allergy will be that after inhaling, or especially in the spring season, or the change of the season from winter to spring, you will have episodes of repeatedly occurring rhinitis, which won't go easily, and it will be followed by the pharyngitis and then upper and lower respiratory symptoms. Sometimes these symptoms are very much severe, in which you have to go to the hospital to see your doctor. Alarming signs which you are supposed to know whenever you have these symptoms, and which will indicate that either you should go to your GP or visit the emergency department of nearby hospital, is that you are having shortness of breath, difficulty in breathing, there is change in the tone of the voice, and there is inflammation around the neck, and you are unable to breathe, or there is drop of saturation. So whenever this type of symptoms occurs, don't wait, just go towards the hospitals. As I told you that wearing the mask is very much important, because if you wear the proper condition proper mask, it will save you from 80% of the trouble, and you won't have these symptoms. But you know that it's small particles, and you cannot actually prevent yourself from it, but 80% you can have the prevention by wearing the mask. Once you get this type of inflammation, then there are antihistamine medicines which you will use for some time, and you will get rid of these infection. But you know, as some people have this disease in a severe form, so then they are advised to use uh, by after the GP consultation, some steroids, corticosteroids are prescribed to them, and they use them. But do not use the corticosteroid on your own. Always and always, whenever these you have the severe symptoms, you are supposed to visit your GP, and then the GP will prescribe you the medicine which you will take it. Okay, so this is a normal day-to-day routine conditions which people comes in during this time of the year, and it's very much important that you know what is actually happening to your body. So we will be talking about much more common conditions, and make it easy for you people, for common people, to understand what these conditions are. Subscribe to my channel, and you will have a lot of incoming knowledge which will be important for you in coming future. Thank you.